Hey viewers, it's been a little while, but we're back with a video, and this is kind of a by request video. I've had some people call me from my office is in Burlington, Ontario, and I've had people from out of the area, Toronto, Markham, places 2 and 3 hours away, that have noticed our videos on YouTube and TikTok, and they're asking for like some longer explanation videos, and that's what we're gonna do today. So this is gonna give you a lot of information, a lot of content. And we happen to have one of our amazing patients, Natasha, here to talk about her story and use her for some examples that totally might relate to you. So, Tasha, if we go into your story a little bit.
For sure.
You started this is the end of March, November, so that's big 4-ish months ago.
Correct, yeah.
You had a lot of problems at the start, and why don't you just go over a few of those?
For sure.
Because your situation is really unique, and
right.
I'm sure that people are going to be interested to hear it.
Yeah, so like Dr. Pete said, my situation has been unique since birth, and as I've gotten older, I'm 24 years old now, I also ran into more complications as I've aged. So basically when I was born, I was lodged in the canal during the birth, and I was very badly tugged, torn. They almost had to snap my collarbone basically to be able for me to get out of the canal of my mother. And due to that, I've had really bad arm issues. Some people call it Erb's palsy. It's not a very severe case of the wing scapula, but I always kind of just thought it was something that I would have to deal with. I have a little bit of a mobility issue, not being able to fully rotate my arm. And for example, if I'm on the phone, I got this kind of wing here that comes out with my elbow. So I really didn't think nothing of it.
I'm going to stop you for 1 second. So when we're talking about birth trauma, and you can have trauma at birth, or it can be later, a football injury, a car accident, but this would be like a really violent pulling of the shoulder down, and the neck would be going this way. So in the lower neck are the nerves coming off the lower cervical spine, form the brachial plexus, that basically give the power, the sensation to the arm. So right side, right arm, left side. So having a trauma would be like a tractioning violent trauma to there would damage the nerves, neck, arm, hand. So you started your life that way.
Correct. Yeah.
So, but if you're older and you had like a football injury or a car accident, you might get like shoulder numbness and tingling in the fingers, arm pain, and so that could be another reason. But you definitely don't want to start your life that way. So let's get back to your story.
So like I said, it was just something that I thought I had to live with. I sleep on my side, so I just had constant back pain all the time, from my neck down to my shoulders, in between the scapula. And then in 2019, I broke my arm very badly. It was an open fracture, the ulna and the radius completely shattered. And it was pretty traumatic.
How did you do that?
I fell. So I fell, and my hip actually landed on my arm, and I just completely crushed my poor little arm. So this is the same arm that I've had issues with from birth. And because I was favoriting my left arm, I was having issues with my right arm. Exactly what Dr. Pete said, the numbness and the tingling started coming. I was noticing issues just with all over, from sleeping to my overall well-being during the day. And my brother found Dr. Pete, and I had just moved to Burlington, and he's like, you have to come see Dr. Pete. Like, he's honestly amazing. And my brother's been going to a chiropractor for a couple years now, but when we found Dr. Pete, it was almost like a miracle. He's like, you have to come. So I went to Dr. Pete, and I didn't really know too much at first about everything, but he has taught me so much, and I've really learned myself. And since I've been coming here, I honestly feel like a brand new person. I didn't even realize the pain that I was going through before. And with the adjustments 3 times a week to start, moving down to 2, and now I'm almost about to go into 1, I am hooked. I have to come almost every week just to be able to get that clarity in me. Consistency is key with coming to a chiropractor. So with me coming to see Dr. P, I feel like all the issues from birth to me breaking my arm are getting covered left, right, and center.
So much there. Thanks for sharing.
Yeah, no problem.
It's an amazing story.
Thank you.
And, total body. So when you have problems like this, it affects your whole life. You mentioned your sleep, your ability to work out. But also, like, if a person lives with chronic pain, it doesn't have to be severe. But if they live with chronic discomfort, I mean, there's some research that it changes things with brain function, and you get so used to it, you don't know how you're supposed to feel.
Right.
And now you can see, and you said, oh, I have to come. And what does she mean by that? Is it addictive? Well, no, but once you feel better, you don't want to go back.
Right.
Just like because you work out, and once you get in shape, you feel good. You don't want to like sit on the couch and let yourself go back to out of shape. So, and it's been slow and steady changing. We have, there's so much we can talk about here. There's 2 laws, Wolff's Law and Davis's Law, but basically tissues in the body respond to what we do to them, the forces that we do to them. So if we're trying to make changes, whether it be a workout plan or changing someone's spine or soft tissues or nerve system, we need repetition to basically, give enough stimulus for long enough for the tissues to get the idea that, hey, if we haven't been functioning, we have to get functioning. And that will happen if you stick with it and a proper plan. Now, I want to throw in here as well, because you guys, you might be watching this, and we have viewers now from like all over the country, the US, outside of North America, and you hear these stories of someone flying to see a chiropractor and staying for a couple weeks, a month, and that is great. And I do have some patients now coming from further away, and they might get adjusted, for a week or a couple days. So I would class that as, and they feel there's tremendous value in that, because we show them what's wrong with them. We do a thorough exam. We might take x-rays. We explain everything to them. We can give them exercises to go home with, and we start helping them. But that is like a chiropractic experience. It's not like getting on a plan, like a fitness plan, where after so many months you're going to correct things. But it's still fine for people to do that. And of course, when those people do go off to where they go to, I would say to them, please follow up with a chiropractor so you can get the care you need, if they need like ongoing care. Some may need that, some may not. But that just helps you understand, I think, like that whole idea, because sometimes if you're watching this, you might think, I got to go see this guy and just let him check me out and let him adjust me and experience it. And you'll probably love that, but that would be different than sticking with consistency. Right. So, and what we're doing today with Tasha is it's actually her re-exam, one of her re-exam days. We re-exam patients periodically. So we're going to go through and sort of talk through what we're seeing and the changes that she's been having. Before we do that, we should show them your x-ray, shouldn't we?
I think we should. Okay. Let's do it.
Let's do that. So Tasha's given us permission to show her x-ray. So this is her initial x-ray. This is a lateral cervical, so side view of the neck. There's a black line here, kind of a C shape pointing. This is the back, this is the front. You can see the teeth. And this is the shape that her cervical spine should be in, and you can see that she's pretty much exactly the opposite. So her spine is curving C-shaped the wrong way, and that we know that the alignment is way off from her exam. We know that the way her spine is functioning is very not good. And if we leave her, she's been that way, well, we don't know how long she's been that way, but she's 24. So if we leave her like this is very likely to lead to continued progression of the problem. So people have heard of degenerative disc disease in the neck, the cervical spine, the lumbar spine. People will come in, oh doc, my doctor says I have degenerative disc disease at C5, 6. So one of the reasons that will happen is abnormal alignment of the spine, leaving a spine in abnormal alignment for a long time and leaving a spine that is mechanically not moving properly that way for a long time. So as a baseline, we don't like to see that, but that is an outcome measure we would check later in her care and look for improvements in that area. So one of the tests that you really would commonly do as a chiropractor are what's known as ranges of motion of the neck, cervical spine, or the lumbar spine. So when we first did this with Tasha, being a younger person, she had slight limitation in the ranges of motion, but she had pain during and at the end ranges of motion. So that's a sign that the joints in the back of the spine are irritated and inflamed. And again, if we leave them that way, they're going to continue to be a problem, and they can lead to degeneration down the road, which we don't want. So we're going to recheck that with her today. So in this position, if you look up to the ceiling as far as you can go. So I'll observe and see how far the patient can go, and we'll ask them, is there any discomfort with that?
No.
That's great. So you're going to look down to the floor. Any discomfort with that?
No.
Good, looking straight. Turn your head as far as you can to the right. Keeping the chin down, yeah. Great. And to the left? And how are those?
This one has a little bit of pain in the scapula on this side, but
When you turn to the right or to the left?
when I go down this way, I can
You start to
sort
feel
of
it, yeah.
feel it in here.
So when she turns to the right, the joints on the right side, neck, upper back, they're coming closer together. So if any of them are irritated, you might feel a pinch or some pain, and she's kind of, you're talking about kind of in here, right?
Exactly.
So we're going to tell you what that is in a second, but not on the left side.
Not on the left side, no.
And then the last thing we'll do is bring your right ear to your right shoulder. You're probably going to feel it again a little bit there.
Yeah, a little bit. Not as much, though.
Not as much. And how about to the left?
No.
Nothing. Okay. And you were mentioning, and you'd been told you have a scapula problem. But really, in your case, one of the problems that you had, and this again maybe from the birth trauma, is that your upper ribs, where the ribs form joints with the spine, so the costo, transverse, and costovertebral joints in this area of the, people will say shoulder, but it's kind of upper back, are really not moving well. Well, they're moving a lot better than they were 4 months ago, but they have a tendency in you, Tasha, because of your neck, because of this arm, to get irritated.
Right.
So now if I press on those rib joints, any tenderness there?
Yes.
Okay. Bad or not too bad?
Not too bad, but
Yeah.
I definitely can feel it a little bit.
And do you remember how it was when we first started there?
Yeah, it was terrible.
It was terrible, yeah. So this is one of the things, when you come and you're getting examined, we're going to do these ranges of motion. We're going to check how all the joints are moving, and we find the ones that aren't moving well, the ones that are inflamed and irritated. We're going to want to address those, as that's going to be part of your healing. So we're going to be as from a re-exam standpoint, this is better than it was before.
100%.
Now. Yeah, which cool. Now another test we're going to do, in the beginning we did a test called the cervical doorbell. It's kind of a funny name, but it's like pressing on the front or the anterior part of the patient's neck. So can you see that, or do you need to come around a little bit? You might want to come from the front. So the way you do this test is you would come on to, so this is the front of the neck. There's the scalene muscles here, and part of the nerve roots that are going to run into this arm, they would come between the scalene muscles here. So if I come in and press on it, and we ask you, do you feel anything there? Any pain?
Not right now. No.
Not right now. And because in the beginning, first exam, when we did this test, you had numbness and pain going down the arm.
For sure.
That test tells us if we do this and the patient responds that way, their nerves are very irritated here, then it only takes a little bit of pressure to set them off and replicate or duplicate the patient's symptoms in terms of pain and numbness and tingling into the fingers. So you don't have that anymore. So what does that tell us? That tells us that your nerves are no longer irritated.
Thank you.
No problem. No problem. So the other tests that we did, we won't do it today, but we checked your muscle strength. So, and we found that you were, this right arm, so the shoulder muscles were weak, as well as were the wrist flexion,
Right.
extension.
Yes.
Those are normal now, but that would be something we would also look at in a case like this. So if you're watching and you notice one hand is weaker than the other, if it's really bad, you might drop things, or at the gym you don't have as much strength on one side than the other, it's very possible.
For me, it's groceries,
Aha.
carrying groceries.
Yep.
This arm is just so weak compared to the left one.
Yep.
It's ridiculous.
But better now than it was, right?
It's been tremendous since I've started coming.
Cool. And I want to say to people, people get used to stuff. Oh yeah, my one arm's always been weaker, or I always get this or that. But is that normal? It might not be normal, right? You might want to get that checked out. Yeah. I get normal headaches. That's a
not
weird.
normal.
Yeah, that's not normal headaches. No headaches are normal. So those are some tests. So what we're going to do now is I'm going to show you the areas we need to adjust today. And again, this is a typical, because Tasha's been coming for months, it's pretty quick. We just do the areas that need it. But when someone's starting care, or if they came first time for the experience, we might be doing more things and might take a bit longer. But we're definitely going to address these ribs and the neck for the adjustment. So to adjust the ribs, and chiropractors, if you're watching this, it's really good to specifically get on the ribs that are involved. So one of the ways I like to do this is so we're doing the right side. I'm going to have the patient bring their arm into their armpit, and I'm going to reach in So around T3, T4 ribs. We're going to take a contact there. And I'm going to wedge my shoulder into your elbow. Okay, so we're gonna reset that. Okay, so just take a nice breath in. Let it out. Good. And moved a little bit.
A little bit.
And moving less because it's much.
I saw you on Monday too.
We came in Monday and we got that moving Monday. So
yes.
That is one way to address this. I'm going to show one other way. Sometimes when I will do an adjustment, if I feel like it needs to move a bit more, I'm going to take a different angle or contact. So I'm going to sneak around the table and do that. We're going to go like this. And actually, those are moving pretty well. I'm going to go, there's a little one right there. Feel that?
Mm-hmm.
About T5-6. Let it out. Good.
Oh.
There. Okay, so again, checking sort of which ones we got partial movement. Now we got the rest of it done. So that's like a complete adjustment for that upper back shoulder area. I don't want you walking out of here with a partial adjustment.
For sure.
The full deal so you can do what you need to do.
Yes.
Now we're going to check the neck. I've mentioned in some of the TikTok and Instagram videos that there's lots of different ways to adjust the neck. Patient on their back, patient seated, patient face down. For Tasha, this way works the best, which is lying on your back. And as I check, so base of the skull, C1, moving good. C2, moving good. C3, moving good. C4, good. Now we're starting right in on the right side, C5-6. What do you feel there?
I feel a little tension.
So when I press here, and then I press here, what do you notice? It's different.
It's different, yeah.
So this just feels probably good.
Yeah, it feels good.
Right? And that feels
uncomfortable,
yeah.
Yeah.
On the left side?
It feels fine.
Yeah.
It's
So
the right.
we're narrow. Now, when she first started, it was upper cervical, lower. It was a bunch of vertebra segments that were involved. Now it's narrowed down to just kind of C5-6 on the right side. And yeah. Okay. So we're going to get that moving.
That was good. I knew it needed to go.
Yeah.
I could feel it.
And again, that's where those nerves are going to be coming off through the spine and going down into this right shoulder, arm, and hand.
Mm-hmm.
Other than like feeling less pain, feeling more strength, what do you feel after an adjustment? Like, how would you describe it, basically?
It's just clarity, honestly.
Clarity.
Like, I feel like I can get more done during my day, and it's not like I'm not like, oh, my back hurts, or like, you're driving, whatever you're doing, working, looking after your kids, the pain's not going to go away on its own magically. So it's nice just to have that worry like taken away and be able to like put my 100% into what I'm doing during my day.
I think there's something else there, which is that when we move, especially there's nerve endings, receptors. You can Google that. But in the joints, and if we do an adjustment, a lot of them send a big discharge of impulse to the brain, and that would give people feelings of like they might be relaxed, might be mental clarity, might be feeling like a weight got lifted off you, and there's all kinds of interesting neurological effects of when we make an adjustment, how the brain changes, and there's more research coming out in that area. But patients, I notice it, and patients notice it. If you get a good adjustment, you just feel different. And sometimes it's hard to put into words, right?
Yeah.
But you just feel like better.
I always say I feel like $1 million, so.
Yeah. And part of that might be some of the research says that we might shift someone's brain function from the sympathetic, which is the fight or flight tension state, which almost every time people come in, they're to some degree or another in that state because of the stresses of life.
Right.
And that can shift into the parasympathetic state where you're more relaxed and calm and just feeling centered. So that's like a general effect of chiropractic adjustments. People can feel that way. It's not always with a neck adjustment. You could adjust their ankle or their low back, and because we're still getting that discharge up to the brain, people will feel that relief and that general sense of well-being. And that's one of the things as a chiropractor I love to give to people, to just know that they left in a better state than they walked in, and that's one of the reasons I love getting adjusted too. So, so that's.
We'll do the other side.
Yeah, of course, of course. Yeah, finish the job. Yeah. And there's just a little bit down here at around C6, 7.
I can feel that actually.
Yeah. Nice, nice. Good. Okay, so that is, you can come back up to sitting.
Awesome.
I should grab the mic from you.
Sorry, here we are.
So that's just some kind of an overview of one patient's story, how we track progress, how they respond, and that might be something where that the different conditions we talked about, neck problems, numbness and tingling, carpal tunnel, headaches, low back pain, stiffness. Chiropractic can really be something for you that could totally turn your life around if you're suffering with those problems. And I would love to help you if you can get your way to Burlington, Ontario.
It's worth it.
Yeah, we definitely would love to take care of you and help you get your life back on track. If you enjoyed this video and are wondering what's next for you, wondering how you can be helped, one of the things you might want to do is check out my book, Function Better, Feel Better, Live Better. You can get a copy of this at Amazon. If you click in the description, we have a link to it. Also have in the description links to my TikTok and Instagram page. Lots more videos, lots more information. If you have any questions, feel free to message. I would love to help you and help get you functioning better, feeling better, and living better.